So next we are going into the fourth nerve. So the fourth nerve, anatomy, the course of the nerve from the midbrain to the muscle is divided into the following parts. The nucleus is located in the midbrain at the level of inferior colliculus. It controls the contralateral superior oblique. That's one important point, superior oblique, contralateral. Whereas in the third nerve you saw superior rectus is contralateral. Nuclei supplies contralateral, superior rectus. Here the superior oblique, it's contralateral and trochlear. So the fasciculi, the fibers decussate in the anterior medullary velum. Basilar part, it leaves the brainstem from the dorsal aspect. It curves around the brainstem, passes beneath the tentorial edge, pierces the dura and enters the cavernous sinus. Intracavernous part, it lies on the lateral wall of the cavernous sinus between the third nerve and the optic nerve. It passes through the superior orbital fissure to enter the orbit. Orbital part, it innervates the superior oblique from the orbital surface. Causes of fourth nerve palsy is trauma, most common. And as you can see the picture, this is how the fourth nerve passes. It decussates, it crosses and goes to the other side, and it's between the basilar artery. As you can see, cavernous sinus it enters, and orbit also it enters along with third nerve. So the clinical features of fourth nerve palsies are vertical torsion diplopia. Diplopia is maximum down gaze, direction of action of superior oblique. So the superior oblique action is depression, and then it is intorsion. So those two things are affected, because of which you will have all these things. Eye is deviated upwards due to underaction of superior oblique depressor. This is called hypertropia. Hypertropia and diplopia worsen in opposite gaze and head tilt to the same side. There is a mnemonic called Voog boot. Okay, Voog means worse on opposite gaze. Boot means better on opposite tilt. So the compensatory head posture is head tilt to the opposite side, better on opposite tilt. So there will be, if there is right superior oblique palsy or right fourth nerve palsy, what I'll do is I'll tilt my head on the left side. So since the patient here, the patient is tilting on the right side, the patient is having left superior oblique palsy. And there is two tests called Bilchowski's test and Park's 3-step test. As you can see, the patient, the same patient, he has a left fourth nerve palsy. So when you tilt on the right side in the first A image, when you tilt on the right side, there is no hypertropia. When you tilt on the same side, there is hypertropia increased. So that is what is Bilchowski's test and Park's 3-step test. You don't have to remember all these tests and all, but just remember the name Bilchowski and Park's 3-step test, along with Voog boot. Voog is worse on opposite gaze and better on opposite tilt. Boot is better on opposite tilt.